Welcome to the latest printed press. I'm Aysen Djemal, and today we're going to be discussing how to get your COVID-19 vaccine, with local vaccine days now being available to the public in Hackney and London. Additionally, we'll be discussing how to stay COVID compliant during the current pandemic. And I'm very happy to have Dr. Mekella Mehmet Yesil, public health researcher and Haringey vaccine ambassador. Welcome, Mekella, to my program. It's lovely to see you.
Nice to see you again, Aysen. Thank you for having me.
Oh, it's a pleasure. Dr. Fulya Yahioglu, who is the Senior Public Health Commissioner. Welcome, Fulya, to my program.
Hi, Aysen. Thank you for having me on as well.
Oh, it's a
Thank
pleasure,
you, everybody.
Yeah, it's a pleasure to always have both of you beautiful, intelligent ladies on my program. And later on, Metin will be joining us from Direct Eco Solutions. But first of all, I mean, obviously our public have had both you lovely ladies on our program before. If we could just have a very quick introduction from Mekella and then followed by Fulya.
Right, well, obviously I'm a public health researcher. I work with Public Health England. I'm obviously also CEO of Health Screen UK Limited, and I'm obviously the ambassador for the Haringey area in North London. And obviously I've been monitoring the figures, the death rates, the vaccinations being done and everything like that. So yeah, that's me.
Brilliant. Yes, thank you, Mekella, for that. And Fulya, if we could have a quick introduction from yourself.
Sure, I'm Fulya, and I work in the public health team in Enfield. I'm a senior commissioner. I commission services related to substance misuse, sexual health. At the moment, I work with two large trusts and work with GPs and with pharmacists. And I've also done some projects with the rough sleepers and domestic abuse.
Yes, and thank you very much again for coming on our program, Fulya. Metin has now joined us. Welcome, Metin, to our program. He is Direct Eco Solutions. If you could just give us a brief introduction, Metin, about what you do.
Good evening, everyone. Sorry for the interruption of coming on. I'm in Devon at the moment, so the connection's a little bit haphazard. I'm Director of Direct Eco Solutions, and we're one of the environmental solutions company that are helping fight against the pandemic, and we're currently working with TCCA to carry out audits on Turkish and Cypriot businesses to see how COVID secure they are.
Yeah, brilliant. And we're going to be talking about that in a lot more detail in a bit. My first question is about the pop-up day, Mekella. Can you tell us about the vaccine pop-up day? And we've got a poster as well, which we'll put up on the screen at some point. But if you could just give us some details about it.
Okay, well, the first one's going to be the 18th of July, which is the Spurs ground. That'll be the Pfizer vaccine. So that's anyone over 18 who wants to get vaccinated. The second one, in conjunction with TCCA, is for Turkish-speaking people and other people as well. Obviously, anyone can come forward. Is Saturday, the 24th of July. And again, that's going to be the Pfizer vaccine. So anyone who hasn't been vaccinated over the age of 18 can come along and get vaccinated. They can speak to people. It runs for 4 hours, so 11 a.m. to 3 p.m. So if you haven't been vaccinated, then pop in, come down, speak to the doctors, the nurses, any information you want, things like that. Pop in and speak to us, really. And obviously, there's another one on the 18th of July, which is at the Spurs ground in Tottenham. So again, it's the Pfizer vaccine that's being offered. Anyone who wants to come along and get vaccinated, who have any concerns or issues regarding the vaccination, by all means, come down.
Yeah, and they don't need to book or anything. They just have to come down.
The TCCA one, I think we have a lady called Sultan who's taking bookings in, but you can come along. There's going to be over 300 vaccines available on the day. So the more people we get through the door, the better. And obviously, it's going to be the way forward now. Yes,
it will be. I think so, because obviously people have done it through different areas, but now they're hitting on certain communities, I believe, that maybe needed the vaccine that haven't quite, completed it. So definitely, I think the Turkish Cypriot community and the Turkish communities are being encouraged to actually get the vaccine. So definitely, we will be advertising those dates again. It'll be attached to our program here as a reminder, and you can watch our program back. We're going to be sharing this program out to many forums so that you can get that information out there. But most of them are happening at the Tottenham ground, did you say?
That's right, on the 18th of July. It's on a Saturday. Yeah, Saturday the 18th of July. That again is between 11 and 3 p.m. so anyone can come along.
Brilliant, brilliant. Fulya, what is the importance of the vaccine, and how many people have been vaccinated approximately now in the UK?
Sure. I suppose vaccination is probably the safest way to gain immunity to the coronavirus. We know that vaccines for COVID-19 prevent you from developing serious illness, moderate to severe illness, and have a large impact of your chances of needing hospital treatment or even dying from COVID-19. So as we've seen, as more people get vaccinated, the train of transmission is greatly reduced. And what we're doing at the moment is heading into herd immunity. So a proportion of the population is becoming immune to the virus. It doesn't mean it stops you from getting COVID, but it will severely impact on you getting ill or dying from COVID-19. So the most important thing is that the COVID-19 vaccines are 2 doses. And the reason why they're 2 doses is what immunologists call prime boosting. They're multiple doses. So the first dose gives you the immune reaction. So anything foreign that comes into your body, you'll get an immune reaction towards it. And then your cells start to remember. There's the second vaccine, which you're given kind of 8 to 12 weeks later, is the one that boosts. So that raises your protection and stops you from getting ill. We know from the 2 vaccines that the length that it confers immunity at the moment is around potentially 6 months to even greater. So they're talking about potentially 6 to 9 months to a year, that if you're double vaccinated. So which is really good. It could potentially be longer, but there's still some work and research being undertaken. Now, as you're aware, there's a new variant of concern, which is the Delta variant or the Indian variant. So it's really important that people do get vaccinated. And this variant is particularly contagious, but it doesn't cause more hospitalizations or death. It just causes illness. So you could still end up in A&E. So it's very important that you get protected, you protect yourself, your family, and those around you and your community. Now, in terms of figures, we're talking about 45.4 million people in the UK who've had their first dose of the vaccine, which is about 86% of the population, which is really, really good. I mean, I think we're probably about the 4th or 5th in the world in terms of vaccination rates. Almost 34 million have had their second dose of the vaccine, which is great. So all the most vulnerable elderly, those that are kind of isolating, who've got compromised immune systems, are being vaccinated. And we're kind of administering on average around 160,000 second doses a day, with the delivery of the second doses being accelerated due to the Delta variant. So the vaccines that are being rolled out are the Pfizer, Pfizer-BioNTech, AstraZeneca, Moderna, and the new one, which is Janssen.
Oh, okay, brilliant. That's great. And I picked up on the fact that you said at the moment there's a guarantee of about 9 months to about a year. So do you think that at some point we may need to be vaccinated? Is that a possibility?
There is. I mean, at the moment, as Mekella said, we've got lots of pop-ups being done in the Spurs Stadium. We've got it in kind of TCCA. So you're kind of supporting those vulnerable in some of the BME communities or communities. So what I believe that they're looking at the moment is, do we need a third booster vaccination from September? They're just looking at the data to see if that's going to be necessary. Potentially it could be, like the influenza vaccine that comes around every year. We may need a booster, but I think most people are being offered the vaccine. I mean, particularly people under 40 will be offered an alternative to the AstraZeneca due to the linking to rare blood clots. But the government is hoping that to vaccinate all over 18 with the first dose, and 2/3 of adults with the second dose by the 19th of July. So it's quite a good record. I mean, a very, very good record.
Yes, it is. And it's quite pleasing to hear that we're like second, third in the whole world. And I do believe that, yes, we had some teething problems, but I do believe this vaccination rollout has been very, very successful.
No, it has been successful. I think we're not quite first, we're not second or third. I think we're about 4th or 5th. I mean, the countries that are doing well are places like Israel, who've done incredibly well, smaller countries. But I mean, we're doing fantastically well, considering we've got about 67.9 million population.
Yes, that's right. We've got some questions coming in, which I will be looking at in a moment. But Metin, thank you very much for waiting patiently. Can you give us an update on the COVID compliance project with businesses? What has happened so far since our last live stream? What are the trends that you found, and where can businesses contact us?
Oops.
Oh, it's frozen again.
It's frozen.
Okay, it's fine. We'll go on to our next question then. And we're going to look at some comments as well in a moment. Mekella, back to you. Rising COVID cases over 32,000 a day. What does this mean?
Well, the cases are going to obviously rise because people are mixing now, and some people, what they're doing, and I mean, if you look at when the last restriction was removed, people started going to pubs and stuff like that, restaurants. So people are intermixing in households. Some people aren't ventilating their homes, keeping the windows and doors open. So you're going to get a high influx of rates going up with infections. But that doesn't mean to say that it's all bad, because basically what's happening is they're catching the disease, they're not being hospitalised. The death rate has gone down significantly, which is a really good thing, obviously. There's only been, like, in the last 28 days, between 7 and 35 cases of deaths, and they've only been tested within the 28 days. So necessarily people aren't dying from COVID now. People may be getting infected, but it doesn't mean to say that it's going to be fatal. So the fact that we're having football matches, sports stadiums open, gyms, clubs, restaurants and things like that, and people are obviously mitigating inside, is just obviously going to increase the figures. And some people, what's happened with some people is they're not practicing the hygiene like they used to, like when they come in from outside, wash their hands or use hand gel. So these things will cause an influx of cases to go up as well. Just a few things really, but it's just, I mean, what we've seen a study, and believe it or not, this is something I was speaking with one of the researchers at Public Health earlier today. Women are less likely to catch COVID, and men are 3 times more likely to catch it because of the hygiene mitigation that women have. So women are more likely to wash their hands, use hand gel, wear a mask, whereas men going to the pub and football games and stuff like that are causing the influx of high cases to rise.
Yeah, so we've got to be wary of that as well. Yeah. We're going to talk about that a little bit, and Boris Johnson and what he said to our public. I'm going to read some comments, and then we're going to go back to Metin, because I think Metin has reconnected with us. Tony Johnson has said, no reason to grow old now that you can get the vaccine and die young. What is our response to that, ladies?
Well, I don't know if you can give a response, to be honest with you. I think, you know, from people that have died in the community from COVID, you know, it's been horrendous. So what I would say is, yes, there are risks to anything, and you can't guarantee, you know, when you pick up a vaccine that you won't get side effects. There's always side effects. You take paracetamol, there's side effects. But I think the side effect of not being vaccinated is that you could become seriously ill and die.
Yeah, so I think we are for vaccinations here. Metin, thank you very much. You're back. I'm going to repeat the question now. Like I said, update on the COVID compliance project with businesses. We did have a live stream previously where we introduced this project. What trends have you found, and where can businesses contact us?
We'll try again. Hopefully my connection's not so bad. The biggest issues that we've seen really with the audits that we've been carrying out is that
we're getting stuck again. Oh, that's a shame.
It is a shame.
Okay, well, we'll try and reconnect. I'm going to read more comments as we're waiting for Metin to reconnect. Emina Osman has said, great to see you all, and it's great to see you. Thank you very much for supporting us and always watching our program. Mehdi Ismet, all the way from Cyprus. We recently did a huge successful joint venture with the TCCA, many other organisations, Wigs for Heroes, Edible London, about sort of awareness of mental health, and it was great. The Rhythm of Breath. He has said, hello everyone, I'm driving now. Awesome guest, have a great show. We'll watch it later. Love from Cyprus. Wow. That's dedication for you. He'll watch it later. Thank you so much. Abby Hussein has said something about Tottenham Hotspurs, right? We actually support Tottenham. So, Abby Hussein, I shall read your comment, but I shall agree to disagree. We have an issue with the name Spursies, but well, you just have to get over that, unfortunately. Yeah. Come and get your
we'll say football stadium. Don't mention the word Spurs.
And they just see it as a venue. Yes, it's just a venue to keep you safe.
Oh, maybe the Emirates can do one as well.
Yeah, exactly, to even it all out. Even though then I won't get to that one. I'm very tricky. We've got Neil, who has written, what about under 18s or children even? What's the plans for vaccinations for them?
Well, at the moment, they're still looking into that. There is no kind of firm response around the under 18s. There are several countries that have started vaccinating under 18s. I think Israel is being one of them, and Qatar possibly. But at the moment, we haven't heard anything about children under the age of 18. I think they're still looking at the studies. So I don't know when that will come into play, but we'll certainly keep people updated as soon as we hear.
There is a study going on at the moment, but there isn't anything like in the pipeline.
Yeah,
definitely. But we know anyone at 18 and above should get vaccinated, definitely, for sure.
Okay, so that's good to hear. And obviously those below that age, hopefully they'll be able to stay safe. They need to keep their precautions when they're going to school. We've only got a couple of weeks left, but yeah, it is very important for them to follow the COVID rules. Aysen has put, what happens if you have already had the AstraZeneca and you are under 30? Is it safe to have the second jab?
Yeah, it is. If you haven't had any kind of a bad reaction to the AstraZeneca and you are under 30, then yes, I think it is safe to have the second dose. I can't see why she wouldn't, but I think, again, speak to a doctor.
Yeah, I mean, definitely. I mean, I'm above 30, but from my own personal, I had the AstraZeneca and I've had both doses. And the first one, I had a bit of a temperature after 12 o'clock at night for about an hour. And then the second time, I had more numbness in my arm and my leg, but that only lasted for about a day. And then I was fine, as right as rain. So really, I would recommend it. I was fine.
Well, I think, I mean, because there's been such kind of scare stories around the AstraZeneca vaccine, around the blood clots, that I think people are a bit kind of cautious around it. And also, I think the government is being cautious. So if you've already had one and you haven't had any severe reactions, then yes, go ahead. But but for the under 30s now, they're looking at kind of potentially the Moderna and the Pfizer vaccine.
Okay, definitely. Metin, we've got you back. We've got to answer our question. Do you want me to repeat it, or I think you know?
No, it's good. Hopefully, third time lucky. So, so the audits have been going really well, but the businesses are falling into two camps, really. Those that aren't really taking their responsibility seriously in terms of trying to investigate exactly what they need to do, making sure that the businesses are COVID compliant. And then we've got several businesses that really are trying their hardest, but with lack of information, don't necessarily know the best way of going around being COVID compliant. And it falls into various misgivings or errors, really. So there's those that have bought chemicals and they're trying to be as hygienic as possible, but they're using antibacterials rather than antiviral agents. So we've advised several businesses about the chemicals that they're using. And then others are really not considering what their business formats are and how to return customers to their businesses. So signage is an issue, one-way systems, etc. And fitting into all the other information that's come through the show today, while the vaccine program is obviously key to making sure that we have herd immunity, businesses, as we reopen, we see the correlation between obviously people re-interacting with each other in their homes, in the shops, and the responsibilities that the shop owners and businesses therefore have to make sure that we don't have a spread increase every time we reopen. Otherwise, we will constantly have this yo-yoing of relaxing the rules, seeing a correlation between mixing in businesses and in homes, cases going up, therefore hospitalization, deaths will increase, and then we'll see a gradual rollback of some of those freedoms again. So we just need to understand holistically what role businesses play, and in the home as well. And it doesn't surprise me that we hear the stats that women are less likely to catch it because of the hygiene factor. So if you see women in the workplace, women in businesses, they tend to be the ones that are more proficient in terms of really good hygiene practices, washing their hands more frequently, utilizing the hand sanitizer. So it's been interesting doing the audits because we've really understood some of the misgivings that businesses have, the misinformation, and also where we can slot in as a direct eco solution, working with TCCA and obviously all of the other community organizations in getting that information to people, really.
Yeah, definitely. It's very important that we do provide this information. So thank you very much for all that you do, Metin, for our community. It's very much appreciated, really, and keep up the good work. And we'll have another update program, hopefully, about how this progresses in the next couple of months. Fulya, what about Boris getting rid of masks? Well, we talked briefly about this before the program, and the bubbles in schools for September. What do you think this actually means?
Well, I think the whole idea of Boris Johnson's stance is that people take personal responsibility, which, I mean, as someone who's kind of works in public health, yes, there is a degree of personal responsibility. But I think the restrictions have helped. As Mekella said, you know, we're opening up venues. You've got people going into football stadiums, you know, 60,000 going to Wembley. They're mixing. You know, no mask wearing, whatever. I mean, it's. I find it really appalling. I have to say.
I agree.
But I mean, unfortunately, that's what's going to happen. But that doesn't stop yourself from keeping up with that regime of wearing a mask. I know the British Medical Association is calling for continued use of face masks and new ventilation standards from beyond July 19th. I think particularly around public transport and large venues, gigs. I think if you're in a confined space for about 15, 20 minutes, then yes, I think I would wear a mask. And particularly if you have a cold or flu or you're not feeling well, then definitely. I mean, if you're not feeling well, don't go out. But if you're feeling you've got a temperature or you're coughing, then certainly wear a mask. In terms of the bubbles, this is kind of looking at school bubbles. I know there's a drive to get rid of the school bubbles, where I think if one child was kind of seen as having the symptoms of not necessarily being COVID positive, but having the symptoms, then to self-isolate. That's going to be scrapped by autumn. And from August 16th, only children who test positive for COVID will need to self-isolate. The government is bringing a COVID testing regime for pupils, which will be transferred to the NHS track and trace system. So secondary schools will be asked to offer pupils, I think, 2 COVID tests at the beginning of the autumn term as a one-off event. I mean, when you can look at the stats, I think the number of pupils self-isolating was a record high of around 641,000 and only 28 confirmed COVID cases. So we know kids, obviously, we're in their bubbles, but as soon as they get outside, we know that they're going to be mixing anyway. So I think it is a case of doing the kind of track and trace, making sure pupils aren't unnecessarily taken out of school, because that's been a real issue. I mean, in terms of mental health, in terms of the work and school records and, you know, young people being isolated. So I think, yes, I think this is probably a bit more a smarter move in terms of the government, in terms of the bubbles. But that doesn't mean to say that schools can't keep having bubbles if they want. I think this is, again, it's all about taking personal responsibility. And if there are, you know, schools can, if they feel that there is an outbreak, then they can temporarily introduce bubbles. I think that's what's going to be happening going forward.
I think it will be individual cases now, and
yeah, it will. Yeah,
like isolated to those incidences and how you deal with it. We've got quite a few questions. We're running out of time now. We're sort of at the last sort of 3 or 4 minutes of our program, but I'm going to go through the questions and any last words. Nalan Bedding has, but absolutely, Fulya. Well said about the vaccine. Emina Osman has written, do the doctors feel that the matches, etc., should be able to go ahead with 69,000 people in attendance when we are clearly not and will not be over this pandemic for some time to come? We all do what we can, but it seems ridiculous that this is happening at this time. What do we think about that generally? Do we agree?
Well, I think we have to agree that it seems silly that you can't bring more than 6 people in a household, but you can go to a match of 69,000.
Yeah.
I mean, I think it's ludicrous, and people aren't wearing masks. There's no social distancing, and I'm sure there isn't any personal hygiene, washing of hands. And I don't believe in Wembley that they would have had hand sanitizers to that degree.
Yeah, exactly.
But it's harder, isn't it, to control that many?
Well, it is. It is. I've been to Wembley, and it is absolutely ridiculous. Coming out of Wembley is appalling. You got the long kind of road, and I think then 69,000 people will get on a train, or some will go in a car. Yeah.
It's how they're getting to the venues, how they're leaving the venues. You're absolutely right. Venue of that size, there's no way that you're going to be able to ensure hand sanitization and disinfection of all touch points. So it's an impossible task to try to police while the venue is live. So that's the issue. It's the upscaling, and I think what we need to kind of differentiate is political moves, political decisions based on finances, economics, and politics, compared to things that are public health issues and public health decisions.
Absolutely.
And I think that's what people are going to have to start to realize, and that's the bit where the individual responsibility is really going to have to kick in now if we don't want to see ourselves in the middle of the third wave.
Yes, most certainly. I think, take individual responsibility. Right. Abby Hussein has put another comment. Would you agree the message we have to learn to live with this virus and somehow get back to normal life? Hygiene practices should apply whether we have a pandemic or not. This is basically exactly what we've just said. So, yes, we are in agreement. Yes, sorry.
Sorry, I was going to say, in Japan and in Singapore, I mean, they often wear masks. It's a standard common practice, so I don't see why we shouldn't follow that route. And you look at personal hygiene, hand sanitizers, etc. Absolutely.
Most definitely. Emina Osman has written, Metin Ali, as ever, your support is invaluable to our community, for sure. And then Michael has written, is it safe to vaccinate someone undergoing chemotherapy? Mekella, I think.
Yes, you can. Yes, you can. It is safe, absolutely safe. And people with those underlying issues who have cancers or autoimmune suppressed, it's absolutely 100% okay to vaccinate those people. And we've had no fatalities in that particular group either. So nothing to worry about, absolutely.
Brilliant. And then we've got another comment from Abby Hussein. He's put North Cyprus today announced 133 positive cases. What's going on?
Well, that's because lots of our London-based Cypriots are going out there at the moment. That's the thing. You're transmitting particularly with the Delta variant, the Indian variant. The transmissibility is high. It's about 70%, so it is more contagious.
Yes. Emina Osman has also said, just want to thank you all for all you do. Gosh, she's so sweet. And continue to do for our work, for ours and all the communities. And we thank you as well, Emina Osman, for everything that you do. And Nalan Bezing has put, Aysen, thank you. Thank you, all of you. Thank you again for always supporting us and watching our programs. Ertanç Abir has also written, it's looking bleak for vulnerable people in view of the rising cases. Do the panel agree? What measures do they suggest for them?
Wear a face covering and get vaccinated. And just practice the protocols like we've been practicing before. On the 19th of July, it's arbitrary, it's not scientific. So if someone chooses to wear a face mask, let them wear a face mask. My advice would be, if you're going to go in a confined place like a shopping mall or a hospital or anywhere else, meeting other people in their home, wear a face mask. Do not go anywhere without that face mask, even if you've been double dosed. It's going to take us a few years to get rid of this virus. If anything, we're just going to have to live with it.
I think the problem is, even if you're double vaccinated, particularly for those vulnerable, you can still catch this particular variant. So you've got to be incredibly careful. Look at all the kind of measures, and if you need to isolate, I think.
Yeah, for sure. We've got one last comment. Abby Hussein saying common sense is our defense, for sure. We're going to go around this wonderful panel that we've had today and have your last words, because we have run out of time of our program. Thank you very much for coming on and informing us and updating us with the COVID-19 rules and the vaccination dates. I strongly recommend for anybody who hasn't had their vaccinations that they attend these dates. We'll put up the dates again, our poster about it there, so all the dates are there and where it's going to be, and I'll get Mekella to quickly summarize with her last words now. Mekella,
well, 18th of July is at the Tottenham Stadium, the Spurs ground, if people want to come along and get vaccinated. And then obviously the 24th of July at Clissold Park, in partnership with the TCCA, between 11 and 3 p.m. So if you haven't been vaccinated, come along and get vaccinated. Like I say, it's the only way out of this pandemic. This virus isn't going to go away, so we're going to have to live with it for several more years. It's going to be like the normal flu, but if you need top-ups, we're going to be doing top-ups anyway for people over 50 and the most vulnerable in the autumn. So any concerns, speak to your medical practitioner, your GP.
Okay, brilliant. Thank you very much, Mekella, for all that. Fulya, any last words?
Well, just to say, get vaccinated. You know the rules around holidays. You know they're gonna introduce the double vaccinated. We'll get much more freedom in terms of travel. If you want to travel, I know it's not the best reason, but if it gets you vaccinated, then that's great, because I think we need to protect the most vulnerable.
For sure, I agree with you. Metin, any last words?
So if you're a business owner, obviously take your responsibility very seriously for opening up to public. You have a responsibility to the people that come in and out of your business. So contact TCCA to find out how we can get you audited and support you and give you all the advice that you need. And on personal levels, just make sure that people, you know, especially those that are vulnerable, you understand that when you're going out there and you're interacting in businesses, that not everybody has got your best interest at heart, unfortunately. It is a reality that businesses are very, economically very, very affected by the pandemic, so they can't necessarily always do the best thing. So take some degree of personal responsibility, wash your hands, carry a personal hand sanitizer with you, so that, you know, if you don't feel comfortable somewhere, you've got an option of protecting yourself. And obviously use the face masks wherever you feel you're in an enclosed space, because again, not everywhere's got the money to have a full HEPA, hospital grade filter in their businesses. So it's personal responsibility at this stage, I think.
For sure, I think that's the biggest message that we've put out there tonight, is to take personal responsibility for your actions as we try and pull through and get back to some sort of normality. But we are going to have to live with this pandemic for a little while longer, unfortunately. Erin Meto has also said, thank you all, amazing panel, big love. And that's where I'm going to leave it tonight. We have had an amazing panel. Thank you very much for coming onto my program and being part of it. That's it from Eurogench TV. Thank you very much to our audiences for all your comments. Have a very good evening. Good night.